are going to talk about the Z code for the diagnosis Z09, which you think, wait, is that a diagnosis? Yes, it is. And they had a question about which one of the codes is most appropriate for this scenario. This is real life coding. Everything has been redacted, of course. Let me just get into reading what they had said.
Oops.
The question was Z09 or Z03.89. I need assistance with selecting the diagnosis code for this case. It's a post-operative discharge. Now, you always look at the pre-op and the post-op, and most of the time they're the same, but be very cautious that the post-op is possibly different. So pay attention when you're kind of speed reading through op cases. You don't want to miss anything. What they have for a post-op diagnosis is an anterior communicating artery aneurysm status post microsurgical clipping. Now, when we flush this out, these are aftercare codes, the Z09 code, and it does get confusing. So they are not actually doing a clipping right now. This is the scenario. We have a 75-year-old man with a history of previously clipped aneurysm by Dr. X. He was referred for follow-up of a cerebral angiogram to rule out significant residual. Risk and benefits of the procedure were discussed. Let's see, with a patient prior to the procedure, very common. These risks include and are not limited to vessel injury, hematoma, hemorrhage, hemorrhagic stroke. The patient understands the risks and benefits of the procedure and elects to the procedure. All his questions are answered. Informed consent was obtained. No guarantees were made. This is very common verbiage. It's almost like it's a template or auto text for most of that. And again, most of that's fodder. The first part is what we want to abstract. There were not findings after the angiogram, the angiography. And so what we want to do next, and I think, Laureen, if you can get rid of everything on the right of the screen. Yeah.
Thank you.
And I do have my reader so that I can see. I am not able to quite see that big enough. Let me see. Is there something I can do to make that? Yes, I can.
Is that good?
I got it. No, it's on my end. I had to make it bigger.
Okay.
So I won't be able to see the conversations that you guys are having, but Laureen will let me know if you have a question.
Yes.
All right. So the diagnoses that she's confused about is Z09 versus Z03.89. This was requested by Beverly. She's a CCO club member. Thank you, Beverly, for your questions. I understand from Laureen, you've had some really good questions that came in, and I know your questions are part of real world coding.
Mm-hmm.
And so that truly helps other people in the club. So we appreciate you taking the time and trusting us to help you with some resources. This slide or this answer sheet was prepped by one of our interns, and I'm probably not going to pronounce her name right, but it's Priyanka Soni, and she's a CPC. All of our interns are certified. Many of our interns are working their A off, but some of them are just expanding their knowledge base.
Mm-hmm.
And of course, this isn't presented by Laureen. It's presented by me. I don't know why it had my name, I thought at the beginning. So I wonder if for some reason we don't have the right thing up, we'll see it. And again, thank you guys for giving us a little grace. So the question is, hello, I need assistance with selecting the diagnosis code Z09 or Z03.89. This post-operative diagnosis was that anterior communicating artery aneurysm status post microsurgical clipping. Now, what we want to tell you is that the procedure that I just read on the other screen, this is not what's being done to the patient. Okay, so that can get a little confusing. What they're doing is they're going to go in and look because the patient possibly has some signs and symptoms, and they want to make sure that there's not a residual from this aneurysm. Okay, so it is true, the post-op diagnosis, that's why they're there. However, we're not coding that procedure. The procedure is actually going in and doing this angiography. So she needs to know is which aftercare code will we be using? So let's look at what the procedure was that was done. The statement that gives us the information is there were no findings after the angiography, and it was not specified the original procedure date. How should this be handled? Okay, so let's just give you a brief overview with these images. I am a visual learner, and so this is what it looks like when they go in and do that procedure. I didn't put the footnotes in to everything we're looking at, but you see this vessel and see that metal clip in the first graphic. You've got the 4 pictures. That metal clip is what they did to take care of the aneurysm, which is a bulging. And they're cutting that off so that it no longer bulges. So obviously this patient came in, there was maybe some signs or symptoms, and they think, okay, is this a residual, a late effect of this aneurysm that we previously fixed? And so if you see in the little drawing graphic, you can better see how that clip takes care of that aneurysm. See the little bulge. Now, when they do the visualization and the angiogram, they're wanting to see the vessels themselves. So they're not looking at it in the first graphic. That's when they did the procedure. Okay, now that that's been done, the last graphic, that's what they're looking at. So they're going to be able to, although this one wasn't clipped, it shows you where the anterior communicating artery is actually at. And if you see right below the green, is that your mouse, the green one on the screen?
No, no.
Okay.
This is my mouse here.
Okay, that's mine. Okay, so it's actually right here, right here. So see that looks like two, this looks like a tree coming up. Spot here in between the 2 arms sticking up. That's that anterior communicating artery. And if that gets an aneurysm, then of course, person can have a stroke very easily, a hemorrhagic stroke. Now, I don't know what it's supposed to look like. This looks fine to me, but that was a graphic that I was able to pull up. So this is what they're looking at, the angiograph, and the findings are, oh, I'll let you move the next slide down a little bit because I can't slide down. I can just move my cursor on the screen. Were you able to see my cursor?
No.
Oh, that didn't do me any good.
You were very convincing.
Just moving my giant green cursor all over there. And
if you want, you can share, and I'll put that up on the screen instead of mine if it's easier.
No, that's okay.
Okay.
I like you driving. Based on the scenario, okay, this is the answer that we came up with. And I want you to know that our intern, kudos, because she did all of the work on this, did the research, and I went back and tweaked it, did an excellent job. And so if you choose to be an intern with us, you get to really participate in some meaty real world questions. Okay, so based on this scenario, the Z09, which means follow-up examination after surgery for other conditions, is going to be the most appropriate code. That was the question. They wanted to know, is it going to be a Z09.0 or that Z03 code? Now let's talk about why it's the most appropriate. The follow-up codes are meant to say, why is this patient coming back? Now we have a procedure, but we have to explain with the diagnosis code, we have to substantiate why the procedure is being done. And so we're given a list of aftercare codes. So the care's already been done. The aneurysm has been clipped. Is everything going okay? There's 2 things you have to ask yourself. If, in fact, when we look at that Z code description, the Z09, encounter for follow-up examination, okay, ding, that checks the mark. After completed treatment, they clipped it, right? So that checks that mark. Other than malignant neoplasm, because they get their own little world, medical surveillance following completed treatment. That's the key. Did they do anything? No, there was no diagnosis. The aneurysm, the clipping, everything was okay. We read that before. So now, if in fact we need to add additional codes, we can, but this is then when you think, okay, I'm in the right place, you have to ask yourself, the excludes one. After care following medical care, surveillance of contraception, surveillance of prosthetic, da 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 da. Those aren't applicable to what so we get to go past that. So now we look at it and says the patient is presenting specifically for the follow-up of the cerebral angiogram. Now, after previous microsurgical clipping of an anterior communicating artery aneurysm, so that's intimidating, right? Because you're thinking, oh my gosh, there's all these arteries. But we went and we looked and we know exactly where that little place was. We know it was clipped. And so we've increased our knowledge base. We know where that artery is actually located. The encounter represents routine post-surgical surveillance. That's the other key, to assess the effectiveness of the previous treatment, which aligns perfectly with the Z09. All right. Now, Z03, this is what she was thinking, but she wasn't sure. Z03 is encounter for medical observation for suspected diseases and conditions to rule out. Now, from what I said in the beginning, you can see why you might think that's the correct applicable and code, and why you think, oh gosh, it's kind of a toss up, right? Because the verbiage is very similar. We're observing, right? We're going in and we're looking, and we've got a suspected disease because it said for a residual, and we need to rule it out. That's true. Okay. However, we don't have a diagnosis. So when a person without a diagnosis is suspected of having an abnormal condition without signs or symptoms, no, that's not applicable here, which requires study. No, we didn't have to really study. We just went in and made sure everything was okay. But after examination and observation is ruled out, the category is also for used for administrative and legal observation status. So as we move down, routine monitoring versus going in and seeing regular follow-up. Is this procedure normally done, making sure that there is no residuals? That's the difference between the two codes. So Z03.89, like she was thinking, would not be appropriate in this case because the patient is not being observed for a suspected condition. This is not a diagnostic workup for an unknown problem. That none of that was listed. The aneurysm history is already established. We knew the patient had that, so it's not a diagnosis. And this is a planned follow-up of care. It's routine to go in and look after this is done. So Z03.89 is used when the clinician assesses a patient due to suspicious sign of disease that is ultimately ruled out after examination. Now, in the beginning, you remember I said they may be having signs or symptoms and they want to make sure there's no residual. Was there any signs and symptoms listed in that information we were given? No. This is routinely done after they do that clipping. They have to go in and look. So it's aftercare, normal aftercare. Now, if the patient was having headaches and they were having slurred speech and other things, and they went in to go look to see if that clip was not holding or any other imaging, they've done a CT and they see something, that's different. That's a Z03. But here it is not. Okay, so since the angiogram showed no findings and no residual aneurysm was detected, you can also assign that the patient now has a history of other diseases of the circular system as an additional diagnosis. So the Z86.79, because the patient has an aneurysm. Now, the last thing, wrapping up, the proper way to code this is going to be two codes. And that's going to be your primary code is Z09.0, the follow-up examination after surgery or other condition. And the secondary code is that personal history of other diseases of the circulatory system. There you go, guys. And again,
Mhm.
you can see how easy it is, especially when you're out there in the trenches. That verbiage gets a little confusing and you're thinking, oh, wait, which is it? Now you have a better idea of the difference in the Z09 and the Z03 codes.
All right. Well, I don't see any questions in the chat, so you must have explained it thoroughly.
Or they're just so dazzled, right?
Looking for medical coding, medical billing, and risk adjustment education? Learn more at cco.us.